So today's question is, what is coronary heart disease? Basically, coronary heart disease is the narrowing of the blood vessels that supply blood and oxygen to the heart as a result of atherosclerosis. So in a picture you can see, if this was my blood vessel, coronary heart disease is the narrowing of this blood vessel as a result of atherosclerosis, which is this abnormal growth that I drew here in yellow called plaques or atheromas. Okay, so simple enough. But now, how do these plaques form? So your body has an immune system, an innate and an adaptive immune system, and this is formed due to your innate immune system. It's called a cell-mediated response. So your endothelial wall is first normal, and then as soon as there's damage or injury to your endothelial wall, your innate immune system reacts and releases an immediate response called inflammation. So this damage results in fats and cholesterol and lipoproteins to all accumulate there at the site of injury, and then this altered low density lipoproteins almost acts as a beacon to call white blood cells to also accumulate there at the site of injury, and this gives rise to abnormal foam cells that initiate the development of atherosclerotic lesions. And in these atherosclerotic lesions, they then form a narrowing of the blood vessels, and this results in inadequate amount of blood supply and oxygen going to the heart, which then later causes a myocardial infarction and so forth. So this is clearly seen as an inflammatory disease. Atherosclerosis is the underlying pathology of coronary heart disease. So now, how do we screen for people at risk of coronary heart disease? Now, that's quite simple if you realize that coronary heart disease has an underlying pathology of atherosclerosis, and atherosclerosis is an inflammatory disease. So you would want to look at your inflammatory markers. And the most important inflammatory marker that we will be discussing is CRP, C-reactive protein, which is a very, very good screening tool for acute coronary heart disease.
The inflammatory marker, and in coronary artery disease, there is inflammation leading to a rise in the CRP levels.
Okay, then CRP can be a risk factor for a coronary artery disease. It can also increase the risk factor for heart disease. And then normal concentration for CRP is 10 milligram per liter.
So, is CRP recommended as a screening tool for identifying risk factors of coronary artery diseases?
Yes, it can be the screening for coronary heart disease, but however, it's not specific because when we describe the coronary heart disease, it is when there is arteriosclerosis, so it's a buildup of fats around the coronary artery. So as there is a buildup of fat around the coronary artery, when there is a blood flow, so that fat around the coronary artery, it makes it to swell and to swell. So that swelling, it causes inflammation. Therefore, if we take the CRP, it helps us to pick up if is there any inflammation, since it's being used as an inflammatory marker. Yes, it can be a screening for coronary artery disease.